At this time, I would like to turn today's program over to Canada Health Infoway. The floor is yours.
Good morning, good afternoon, regardless of where you are. This is Dennis Giokas, CTO with Canada Health Infoway. I'd like to welcome you as well to our seminar today on mobile computing in clinical settings. And we have today Mark Nenadovic and Stanley Ratajczak who will deliver this material for you in just a few minutes. But just a few housekeeping notes. I just want to notify you that this presentation is being recorded for informational and educational purposes and will be posted on our website in a few days after this event. And as Mandy mentioned, please use the Q&A feature if you would like to ask questions, and then I'll present those to the presenters at the end of the session. Just a couple items of housekeeping as well around disclaimers. This represents solely the views of Infoway. It's meant to be informative. We may mention technologies or vendors, and it's not meant to particularly endorse any of those that we might mention in the course of our remarks during this presentation. Just to give you a little background about the group, we have one slide here on our mission and vision for those who are here for the first time, so you get a sense of what we do. Our primary objective is to identify and assess viable emerging technologies that could or should be used in the healthcare sector within Canada, and to generate a set of papers to make recommendations and considerations that our stakeholders should use in evaluating them themselves and using them in their digital health ecosystem. So our vision is to help our stakeholders to use these in an appropriate and an effective way to promote the health of Canadians and the sustainability of the healthcare system. We'd like to take a very specific approach to differentiate our white papers on these topics from others you might get and read. Our objective is to take a very broad versus deep perspective with our stakeholders in mind. We always, as we are in this one with mobile, taking this into a health context, particularly into a Canadian digital health context. And if you've seen the opportunities for action that the Canada Health Infoway published, with a lens toward the strategic priorities that Canada has established. In addition to the business side of the equation, we'd like to take a technical view as well. One important dimension are the privacy and security considerations with respect to these various technologies, and that's certainly top of mind with mobile. We also look at deployment considerations and how you might apply these technologies with specific digital health functions in the context of Canada's priorities and relationships to other components that you might have already implemented in the context of your digital health ecosystem. Just want to remind you, we have two other major publications that are on our website, one on cloud computing in health, one on big data and analytics in health, and this one is posted there as well, so please have a read at either the executive summary of the full paper and stay tuned for more in the coming months. So without further ado, I'd like to pass it over to Mark Nenadovic and our topic today, mobile computing in clinical settings. Mark.
Great. Thanks very much, Dennis. And let me be the third person to welcome you to today's webinar. I'm going to adjust our camera here. I hope everyone can see me there. As good as it's going to get today. I'd like to be able to welcome you and, of course, share with you the latest research that both Stan Ratajczak and myself have done. We hope that the white paper that we've produced will assist you to move forward with the mobile health and computing agenda within Canada. So it's important to note at the top of today's presentation that our paper doesn't deal with the consumer side of mobile health. So we're not researching or writing about the personal health and fitness components of mobile health. Rather, we have focused on the clinician, the use of that technology by that particular group of people. It includes physicians, nurses, and others. We provide clarification on the definition, characteristics of its use. We're always interested in the return on investment, so we speak a bit about the economic value. And I know that this latter part may not be of interest to everyone on the call, but we also have an extensive discussion on the deployment considerations. So we look into considerations that relate to privacy and security through the use of these devices and apps, and of course some of the operational considerations. Well, it's probably helpful to begin with a common understanding. And If you've looked out there like we have, you'll notice that there are several definitions for mHealth or mobile health computing. Not surprisingly, there are slight variations in what it means to people. I think there's a commonality, though, and we've likened the mHealth Alliance's definitions that they use, and we like it because we think they're in the right space. You know, they're focused on clinical practice and they're focused on improving clinical outcomes. I've highlighted some of the key words in the definition here for you. It really is, in the first instance, about enabling health practice through the use of mobile devices, whether they be telephones or rather smartphones or tablets, and of course, creating innovative opportunities for clinicians to improve and change the way in which they deliver care to their patients, share information amongst themselves and with their patients. So this is not a picture of Marlon Brando from the Godfather trilogy. I first made that same mistake. This is, of course, Marshall McLuhan, and he was one of Canada's great thinkers and was a prolific writer and media theorist throughout all of his career. Very prolific writer in the 60s. And he contended that technologies, while being invented by people, actually serve to reinvent people. And his contention was supported by his view that Gutenberg's invention of the printing press in the mid-15th century served to shift peoples and societies from an oral tradition of sharing and disseminating information to a more automated one, to a more efficient means of moving information from a source to an audience. Of course, it included increases in literacy among populations. In fact, he believed that that technology, that emergent technology, was one of the key drivers and one of the key reasons behind the French and American revolutions. Now consider a current and electronic scenario. Consider internet activism, the role of BlackBerry's messaging service, the role of Twitter and Instagram, and how they have played their respective parts in the Arab Spring, which is just 3 years old, how they have moved societies and countries towards democracy. So is McLuhan correct? Has he indeed achieved his vision where technologies actually serve to reinvent people? Are we changing healthcare? We at Infoway believe that clinicians are changing, the way they practice is changing, and in fact, healthcare will change. We're starting to see evidence of that today, and we expect to see significant transformations as we move forward into the future. But why? Why are we doing this? Well, the first and obvious reason is that virtually all of us have these things, these devices and these apps that work on these devices in our hands. It's an innovation platform for vendors and other entrepreneurs. It gets us thinking about how we can use these devices to improve the way in which we practice. So we've got increased awareness amongst our clinicians. They're also aware that we have sustainability issues in our healthcare system. They know that their role is one of almost virtual movement. They're continuously on the go. They're moving from a care setting to another care setting, to a procedure room, to providing education, to doing rounds, to treating patients in different environments. And as a result, this small form factor can move with them, and it can do things. It can connect them to information, connect them to one another, and they can speed up care. They can move their patients through those episodes more efficiently. And lastly, of course, and something that we've spoken about in our previous papers, is this convergence of technology. Mobile computing combined with social media and cloud computing has really increased clinicians' ability to innovate and transform the way in which they practice. Convergence has enabled innovation and transformation. But in reality, how are most clinicians using these devices? Well, in the first instance, many of them own them. They bring them into their practice, whether it be a physician practice or a clinic or a hospital or some other environment where patient treatment is occurring. And the reality is that they're using them in probably the most simplistic ways, but very valuable ways. They're looking up information that will support their practice. It could be about medication, it could be around dosing calculators, and so forth. Of course, they have access to information from guidelines, and that helps with the improvement of patient safety. Now, these stats I'm about to mention are about a year and a half old. It probably increased, but when we got a hold of these stats, near 70% of Canadian family physicians were owning a smartphone. Of those that owned a smartphone, over 80% of them were using them in their professional practice, primarily for the reasons of looking up drug references. But a full half of them were using them for clinical decision support. Now, this is both an opportunity and potentially a challenge for health delivery organizations. The opportunity, of course, is that we are improving access to information. We are improving the speed at which we can practice medicine. We are ideally improving the safety of practice of medicine. But we have a bit of a Wild West occurring here. We have clinicians who are moving forward and evaluating, selecting, acquiring, and installing professional apps for professional purposes and bringing them into the health delivery organization environment. They, in fact, many organizations are moving at a much faster pace than the IT enterprise is moving. So it's a bit of a catch-up. That's the challenge for the IT professional, and we're going to talk to you a bit more about that in today's presentation, and a lot more in our paper if you are able to read it. So what is it that clinicians actually want from mobile health? Well, one of the studies that we cite in our paper is that clinicians, in the first instance, want convenient access. And the access that they want, the convenient access they want is to their patient records, whether that's found on their medical records in their practice, or whether that be the hospital information system or the regional health authorities' databases. There's a sense of integration, a need for integration, interoperability. We don't want to create additional silos of data, and we don't want to create a separate channel that requires additional set of credentials and effort to use, because that will impact ease of use, convenience, and, of course, adoption. Last but not sure, as clinicians, we're interested in ensuring that the devices and the apps that we use on those devices are indeed safe, that they will do no harm, they're efficient, they have efficacy about them, and where needed, they are certified by the appropriate authorities. So what has been some of the promise? Well, if you're like Stan and I, you've read many of the multinational consultancies' reports. There is a lot of hype and promise, and that's pretty standard with respect to new technologies in healthcare. We're seeing claims of improved access, improved quality and safety, and of course improved productivity. And it's likely true to a certain extent, although the evidence isn't all in right now. Certainly some of those studies point to increases of productivity in the order of 20 to 30% for physicians, particularly on the administrative side of their practice. So hence we can see a huge benefit to those practitioners. But what is it that we can really offer clinicians through the use of mobile health? Well, they know certainly before we do, because they've been using it. But what they do want, as I've said earlier, is that access to personal health information. But it provides opportunities for them to do more than that. It provides opportunities to establish new ways of practice, such as e-visits with their patients, virtual care or virtual care wards, and of course, if information is available to them at the time of their decisions, such as clinical decision support information or order entry functions, we'll likely see improved patient outcomes. We'll likely see better patient safety. And last, we do offer opportunities for clinicians to do things differently, to collaborate and coordinate one another in ways that they haven't been able to do before. We can transform their workflows. We can transform, indeed, some models that are present in place of healthcare delivery. We love this example. We included it in our paper, and we've included it in today's presentation because we think you're going to love it as well. It's a terrific example of the use of emerging technologies that's transformed care processes, resulted in impressive gains of access and productivity and quality and safety for patients. For those of you who don't know Women's College Hospital, it's a hospital here in Toronto, but it's actually an ambulatory hospital. And what that simply means is that they can't have patients overnight. And that means all discharges have to occur within 24 hours of admission. So back in 2011, 2012, surgeons began a pilot using these emergent technologies. They had a standard reconstruction procedure that they were doing with patients. And they thought, how could we use mobile devices to change the way in which we practice? How can we use these devices to ensure a safe recovery of our patients, even though they're not going to be in hospital. Well, they issued smartphones to their patients, had them for 30 days. They issued tablets to the surgeons who followed these patients. Patients and the physicians used mobile apps, and the patients completed a post-recovery questionnaire on a daily basis that they download or rather able to access from the cloud. On a daily basis, these patients took images of their surgical incision, and on a daily basis, the physicians, the surgeons, were able to log into the cloud, review the results of the daily recovery questionnaire, and view those images. And obviously, you're probably guessing that to see if the patient was progressing as they should be expected to progress toward their recovery. And where they weren't, they were able to do earlier interventions, get at an issue before it became a real problem. The results are fantastic. You can see in the blue ribbon there that they were able to maintain with success these patients after discharging them as early as 18 hours, on average 18 hours post-procedure, versus the industry average of 6.4 days for standard care, that is, on an inpatient basis. Results were dramatic. It was reductions in the cost, reductions in two important metrics, which we're all aware of, readmissions within 30 days and ER visits, and of course, most importantly, we had increases in patient satisfaction versus the standard care, largely because patients were in their own home being cared for by community services, monitored by their care teams in the hospital, including a surgeon, and didn't have to travel medical appointments, didn't have to wait as long to access their care team as standard practices of care. So, if we want to achieve that kind of success, we have work to do. In fact, we have a lot of work to do. We've had this pervasive networking in place. Mobile computing is here, and it's causing clinicians to expect to be able to service their patients in different care settings and contexts. They have high expectations of us, high expectations for the systems, that they be responsive and they be highly available on their mobile platforms and applications. The goal, of course, is to integrate mobile health into the vibrant digital health ecosystem, and that means we need to expand the communication and collaboration functions to meet clinician expectations. And this is a slogan that we use internally here and starting to share more externally at Infoway, that we need to provide clinicians with access, in this case mobile access, to content with minimal disruption to their workflow. And that is key. But there are challenges. Not easily done, and this really begins with strategy, an integrated mobile strategy into the enterprise's IT strategy. Of course, that all needs to align with the business transformation strategy that enterprises have in place. But there's some really basic challenges. It's a bit of the Wild West. How do clinicians sort through the tens of thousands of available mHealth apps to find the most appropriate one for their professional needs? How do they validate that that app can interoperate with the systems that they use? How can they ensure that they're private and secure and that personal health information isn't being released into the wild web? There's basic questions that we need to ask ourselves around care models. Can we reinvent some of the ways in which we deliver care now that we have mobile technologies? That is work, that is planning, and that requires careful consideration. Dan's going to speak to you a lot more about the need for changes to our policies with relation to the use of mobile devices and regulations. And there's some very basic things, like these are small devices. They can get left behind. They can be picked up by an unauthorized person. They'd be left in the cab. You've heard these stories before. The primary concern, of course, is that someone's going to get unauthorized access to personal health information that's either stored on the device or is accessed by it. So these are real risks to the health delivery enterprise, notwithstanding concerns around infection control, because these devices do follow the clinicians from location to location, patient to patient. I think for those of you who may start, this may be a familiar concept, or maybe some of you have been fortunate to have success, or maybe some of you are just starting to think about moving forward with your mHealth initiative. But a lot of these pilots have been characterized by stalled starts. A lot of them don't get past the proof of concept. There are many reasons for it. We can talk to you about some of this in the question and answer, but sometimes it's because they begin at the edges of the enterprise by the clinical champion, and they have great early success. but they aren't integrated into the overall enterprise's IT strategy, or perhaps even aligned with the enterprise's agenda for improvements. As a result, there could be overlapping approaches to governance, and planning, and procurement, and security, and so on. So what can influence the outcome of your mobile health project? What are some of the deployment considerations that health delivery organizations should be thinking about? At this juncture, I'm going to turn the presentation over to my colleague, Stanley Ratajczak. He's going to walk us through some of those key considerations. Stanley?
Thank you, Mark. So in the next series of slides, what we'll do is we'll provide you with a series of considerations that will enable the integration of mobile devices in a cost-effective and sustainable manner that would allow you to have access to clinical information. So this slide represents a typical enterprise mobile solution that would allow access to clinical information. Today we're going to focus on two major components, and those are the mobile device management component as well as mobile middleware. Today, clinicians, when they do have access to clinical information, typically access that information either through a web browser application on their device that is typically sitting on some type of mobile portal, or they're accessing clinical information through mobile applications that they've downloaded and are resident on their devices. Now, each one of these mobile applications, unfortunately, needs to be written or developed for the individual operating systems or the various devices, which means that if an organization supports multiple mobile devices and they wish to provide access to clinical information, they have to develop separate applications for each one of those devices and manage them over time. So when we're thinking about a large-scale deployment, that is not a sustainable situation. So how do we solve this problem? Well, we feel that one of the major components of an enterprise mobile solution will be mobile middleware. So what is mobile middleware? Well, it is essentially the ability to interconnect disparate mobile applications to clinical information systems. So it facilitates a faster access to clinical information for clinicians. And what are some of the benefits of mobile middleware? Well, it allows you to develop one application that can run on multiple mobile device platforms. So whether it's Android or iOS, no need to develop separate applications for each one of the clinical information systems that you want to provide access to. You develop it once. Obviously, this improves the speed of deployment and allows faster access to clinical information. One of the other advantages of mobile middleware is that it can reduce the complexity of implementing and deploying the new and emerging interoperability application standards that we're starting to see in the marketplace. So incorporating those interoperability standards into mobile middleware, into that one application that runs on all your mobile devices, is powerful because it allows you, again, to provide better access to more clinical information at a faster pace. One of the challenges that many organizations face with regards to large-scale deployments of mobile middleware is the fact that they have to purchase the software, they have to purchase the infrastructure, the servers to implement mobile middleware. And we're seeing a trend in the industry where mobile middleware is now offered in the cloud as software as a service. So again, this could be stood up rather quickly by most organizations if they avail themselves of that capability. Another thing that mobile middleware does is it supports the context of mobile computing. So it essentially offers a seamless access to clinical information because it addresses problems like connection and reconnection and disconnection of wireless networks or devices between wireless networks. So the hospital information systems don't lose the context in which the information is being shared with mobile devices. Again, this is something specific to the mobile computing context. The second most important component of an enterprise mobile mobile solution is mobile device management. And that's typically a solution which is software and hardware infrastructure that needs to be implemented. So what does mobile device management do? Well, it essentially manages, monitors, and maintains all of your mobile devices and their applications. So its benefits allow you to manage the devices, the applications. Whether you have multiple devices in a BYOD context or just one group of devices within your organization, it can manage those. It can manage specific device features within applications, such as when do you turn on the features of a camera within a clinical application and when do you not. It is also one of the primary privacy and security risk management tools, and we'll talk more about that later. The next 3 slides will summarize a series of privacy and security considerations that we have identified in our paper. And the first one is that clinicians require a seamless security experience. Today, clinicians have far too many electronic credentials and passwords or authentication schemes. The fact that we're adding mobile devices and new mobile applications into the digital health ecosystem should not entail an additional burden of more authentication schemes and more electronic credentials. So we have arrived at a series of considerations, namely the first one being organizations should try to leverage as much as possible their existing privacy and security mechanisms. That is, please provide clinicians with one electronic credential and one authentication scheme that they can use, whether they're accessing clinical information from a mobile device or any other device within the organization. There are several healthcare organizations that we're aware of that have actually used mobile middleware to develop applications that leverage their existing electronic credential schemes and authentication schemes. So it is entirely possible. An interesting trend that we're seeing in the mobile device marketplace is the fact that mobile device vendors are starting to deploy device-specific authentication schemes such as facial recognition. While these may be perfectly adequate for an organization that's deploying one specific device, we've identified the consideration that you may wish to give serious thought to employing device-specific authentication schemes when you're supporting multiple devices. It becomes a rather complex situation should you want to do that. Another consideration we've identified has to do with the fact that clinicians want and expect trustworthy mobile solutions, and they expect that their vendors and health delivery organizations will provide them with those solutions. A recent study by HP indicated that 9 out of 10 enterprise mobile applications had vulnerabilities that exposed the devices to hacker attacks. So how do we address that problem? Well, one of the first privacy by design principles that we should give some thought to is not storing PHI or personal health information on the device. The Ontario Office of the Information Privacy Commissioner in Ontario has identified or made a ruling recently that all personal health information stored on a mobile device must be encrypted. So organizations need to give some thought to that should they want to store personal health information on the device. The next consideration has to do with ensuring that devices meet your organizational security requirements, standards, and policies. So from a privacy and security perspective, clinicians or patients have the same expectations with regards to privacy and security on mobile devices as they do with any other server or laptop device. So how do you ensure that your mobile apps and devices meet those security standards? Well, you most likely would have to do some type of due diligence to understand what your privacy and security risks are with applications, what their features would be from a privacy and security perspective, and what, if any, compensating controls you need to put in place. Because ultimately, custodians, data custodians, need to ensure that they meet their regulatory responsibilities, whether you're a clinician or an organization offering these devices to clinicians. As I mentioned earlier, mobile device management services is a primary or an important privacy and security risk mitigation tool. What it does is not only manages your devices, but it allows you to manage security profiles. It allows you to manage the vulnerabilities and flaws associated with operating systems. We all get the messages on our smartphone that it's time to update the operating system. Well, this can all happen automatically with a mobile device management service. It also ensures that only authorized software is used in the context of a health delivery organization wireless network. So things like ensuring that the malware version of Angry Birds cannot run on your wireless network in your facility are important aspects to manage. It also allows you to ensure that you have malware software or malware protection on your mobile devices, and that software is maintained over time. There's been a tremendous increase in the amount of malware that we're seeing on many mobile devices, and that can be managed with MDM. We're also well aware of the trend of clinicians bringing their personal devices and using them in a professional context. What this does essentially is it increases the level of complexity associated with managing security and privacy safeguards on these devices, because these devices are still owned by the employee, they're owned by the individual, and they wish to maintain some type of control over those devices. So we have a whole series of considerations in our paper that talk to how we manage these risks. And the first consideration talks to the fact that these personal devices should be no different than an organizationally owned device. In other words, they should apply the same privacy and security safeguards as any other device, which is a challenge in itself, but that's the goal that that we should try to achieve. The other important consideration is that organizations should develop a BYOD strategy and implement the appropriate security and privacy policies. Things like organizations typically back up the applications and the data on their mobile devices. Well, if you are also backing up BYOD type devices that are owned by clinicians, then you may be backing up their personal data and their personal apps. So what guarantees from a privacy perspective do you offer them in that context? There's also things like organizations, in the event of lost or stolen devices, would do a remote wipe of a device, i.e. remotely erase everything that's on that device. Well, you need to have special agreements with the clinicians that own these devices, because you will be erasing their applications and their data as well. So again, very specific policies. There's a lot of material out there that can be leveraged to develop these. And also of note is the fact that the BYOD context is a major source of introducing malware into healthcare organizations. So how do you manage those? As I mentioned earlier, the ability to use mobile device management solutions will allow you to manage those malware risks. Okay, Mark, the next series of slides.
Great, Stan. Just switching the camera over. I think we may have lost you for part of that presentation. Your patience, everyone on the call. Okay, there I am. So, Stan, I think you've scared all of us from using mobile devices in our practice. Obviously, with the upside comes a lot of consternation and considerations for its use. And I think we're very encouraged for the potential of the device. And in fact, we encourage organizations to continue to pursue agendas in this space. It is going to be a transformative technology, but it's not without consideration for risks that are inherent in its use. So, I mean, the summary slide's really the message that we want to leave you with today. This and the next slide will speak to some of the action items that we suggest in our paper. Of course, these technologies are being introduced with a lot of hype and much promise. It's a promise that we believe in. But similar to the features of the electronic health record solution, the goal of developing a vibrant mobile health ecosystem is the creation of seamlessly connected clinical and business applications through the integration of mobile devices, communications, and transactions. We need to remember that good user experience requires access to content with minimal disruption to workflow. And that may require us to create some transformations in the way in which we do business, the way in which we deliver health. We need to be open to those ideas and open to the levers that will help move that particular agenda forward. Dan has shared with us how important PNS is, privacy and security, and it continues and extends to the use of devices. And I'm sure many of you in your organizations know that these devices aren't being used appropriately right now. There's a lot of texting that goes on between clinicians purely by its convenience, but it's not secure messaging. And we put ourselves at risk. In fact, one physician that was in a workshop that I was part of recently that, you know, we're just one headline away from dramatic changes in the way in which we use devices. Because once the media learns how some information is shared, and if it gets out that there's been releases of personal health information, then we'll all be held to account. And I think is right. Of course, Infoway's view is that mHealth is more than an emergent set of technology. We believe that it should be regarded as a priority component of your health enterprise's IT strategy, and we believe it should be supported as a key platform. So before we open it up to some of your questions, and thank you for those of you who've been sending them in, we've started to curate them, but we are interested in having a dialogue. We will have time for that, so please continue to use that Q&A function. Some of the call to action items that we include in our paper really starts at the top and makes its way through all the other levers. I think for all of you who are technologists or even end user technology, you know that, what's the saying, like 90% of the challenge isn't related to the solution, it's related to all of the components that surround the solution. And our call to action, which is much more extensive in the paper, really covers the waterfront. And we suggest that you begin, if you haven't begun already, or even if you have started, you don't have executive leadership or sponsorship of your initiative, that you make sure that's in place, including the governance of the use of mobile devices and apps within your enterprise environment. A good foundation really requires strategy, really requires a planful approach to that change, and if you haven't stopped to do that, it's a good starting point. You'll really want to build the foundations in a strong way, and part of that is through a planful consideration of the way in which your roadmap will move forward from this point on. We believe in consumerism. We believe it's a very powerful force. We don't think you're going to be able to stop people being enthralled with the latest devices and the latest gadgets and technological kind of advances that are so often outpacing what enterprises can do. You'll likely have to embrace a BYOD model if you haven't already, and it has its advantages, of course. So we've talked about some of them, but an important one is it reduces the barrier to entry. There's other people buying capital equipment for you. And of course, Stan's talked about how to integrate those into your enterprise, your IT enterprise environment. I won't spend any more time other than remind you that privacy security is probably a key message you need to take away and have at the forefront of all of your actions as it relates to mobile health. And one of the things that we advise our stakeholders is that every future software deployment, anything new that comes into your organization or greenfield opportunities that you have or software that supports clinical practice, be sure that it includes a mobile interface. It's in everyone's best interest to do. Lastly, I think the important thing that we all want to remember is that much of our policies that in some ways are stagnant and sit on shelves and are rarely referred to until they're required to be referenced, they need to be dusted off. They need to be updated to reflect many of the issues that Dan shared with you today. And we need to set in place a set of expectations for the use of these mobile devices that is commonly understood by all end users so that we don't get on the front page of the newspaper. So, Dennis, I think I want to conclude the presentation. I want to say that we are very enthusiastic about this development. We hold great promise for the use of mobile health in care delivery. We are, as a sneak to the future, we are actually writing a paper right now that speaks more to the patient use of these devices and apps. It will be a companion piece to this, but we wish you the best of luck with your mobile health initiatives. We are available to have conversations with you should you wish to access some more insights from Canada Health Infoway. Dennis, can I just flip to the next page where we'll show folks where they can get our white papers, including the one that we've just presented on, and I'll turn it to you to curate some of the questions that have come in. Thank you.
Great. Thank you, Mark. Thank you, Stan. Very informative. And so I just want to remind folks, please use the Q&A panel to enter your questions, and I will pose them to both Mark and Stan as appropriate based on the subject matter. Got a very simple one here. We use this acronym in the presentation, HDO. That stands for Health Delivery Organization. Could range from a community pharmacy to a very big and complex academic health sciences center. So we use that term very broadly in all of our papers, in case you haven't seen that being used before. We've got just a few other questions here on the curation of applications. Do you have any thoughts on how these applications can or should be curated, Mark? And maybe, Stan, you could cover, too, some of the certification and licensing aspects of these apps and devices as well, because that's another aspect of this for our stakeholders.
I think that's a great question. It is an area which we do discuss in the paper, and so do I have some thoughts? Well, sure. The short answer is yes, they should be curated. You know, the various app stores, the big ones out there, have something like 100,000 apps right now. There's in the order of 15 or 20,000 that are targeting the medical profession, the clinical profession. And it is, frankly, a location for the storage of these apps, but it is not curated. There are services that are starting to emerge in the marketplace to provide this. Some of these services will host it externally in the cloud for you. Some will brand it, be white labeled and branded for your organization. Others will provide the service on your behalf, come into your environment and set it up for you. But when you think about it, it's a bit like prescribing, the prescription process. You know, if we're able to order a lab test, or if we're able to prescribe a medication, it comes from a formulary. We have some confidence in the test or the drug that we want to prescribe or order for our patient, and we want to be able to practice mobile health in a similar way. So I agree, Dennis. I think there's a need for curation. I think that it helps with the trustworthiness, and it helps with the efficiencies of that process. Stan, did you want to talk a bit about other aspects?
Yeah, I'll just add a few points, Mark. I totally agree that you know, there needs to be some type of curation for healthcare organizations with regards to the apps that they've either acquired or developed. And that typically helps you to ensure that only the most recent apps or versions of applications that you feel comfortable with, that you've done your due diligence, or you've been able to achieve some type of third-party certification of either the interoperability aspects of your application, features, or privacy security aspects of your application. So once the due diligence and the certification or certification has been completed, you can then put those into the curation portion of your mobile device management solution, and then ensure that only the most recent applications or versions of those go out to your mobile devices and to your clinicians. So it plays a big role in trustworthiness, as well as your fixing bugs and things like that.
And then licensing and certification, Stan?
From a licensing perspective, absolutely. I mean, if you've purchased a license for an application, and then for some reason you no longer do business with that vendor, then you remove them from your curation, and you deprecate those applications with regard, with the mobile devices and that the clinicians are using. If you're buying a new license, then you can actually promote those applications through your own curation sites or management capabilities.
I probably should have been clearer. Health Canada licensing.
Health Canada. Okay, so that's the licensing of devices for medical purposes.
Or the app that might sit on a mobile device that might be managing a medical device.
That's correct. So some applications may be classified as medical devices by Health Canada, and then that would require a licensing and a licensing process. And again, that's critical to achieve that licensing before you actually put them on your creation sites, and that you deploy only applications that are licensed if that's what you need to do, if they're classified as medical devices.
Great, thank you very much. We actually had another question that I'll give to you, Stan. Are you familiar with any Canadian health delivery organizations that you'd consider leading in the area of mobile device management?
Yes, the Ottawa Hospital. They're the ones that actually were able to stand up a mobile device management capability in a question of weeks rather than months, because they went to the cloud and sourced that service from a cloud and were able to implement it rather quickly, and it helped them manage their large-scale deployment of devices.
Great, thank you. Mark, there's a question here about mobile devices in the clinical environment and specifically related to infection control. I know we've looked at that a little bit.
We have looked at that a little bit, and it is a real issue. I think the response, the risk, I think I mentioned, but you can imagine a device that's moving from patient environment to patient environment, and it can be a source of transmission of infection from one patient to the next. There's a need to maintain a standard of practice in relation to the mobile device. In the paper, and it's not unlike any other practice, we need to begin with an understanding. There needs to be a sensitivity, an appreciation for the risk. We need to have a standard way in which we practice with the device like we would any other device. And in fact, after an appreciation awareness of the issue, we need to support it with education. So it may be entrenched in policy, but the reality is that those clinicians who are using those devices and are in contact with patients have to be aware of the risk and have to take the appropriate precautions to avoid the transmission of infection from patient to patient.
I guess it'd be true on even computers on wheels or computers at a nursing station or in the exam room. I mean, the infection concern is not just specific to mobile, but literally any computing device or even medical device that may be in various patient contexts in the course of delivering care.
I agree.
Stanley, I'll give this one to you. We got friends up in the Northwest Territories are currently researching BYOD policies and are interested in finding some resources that could help them on that research endeavor. Any suggestions there?
Yes, there are actually quite a few webinars and other sources of information with regards to policies that obviously have to be tweaked. In our paper, we have a reference to several security and policy resources that are from the U.S. for now, but they're still quite appropriate for use. And we encourage you to go to the paper and pull down those resources. The links are in our paper.
So one of those might be the mHIMSS roadmap, or?
Yes, the mHIMSS roadmap.
Yeah, so just call your attention to that. Stanley already mentioned, the Ottawa Hospital, and you may want to contact some of your colleagues in other jurisdictions with respect to that. And we have a few of these that we've collected, so certainly feel free to write us, and if they're shareable, we'll definitely share them with you as well.
I am aware that some hospitals have shared their policies with others, and we tend to be tend to encourage that and tend to behave that way as colleagues. So we can make some connections or introductions. We're happy to do that.
So Mark, you highlighted the lack of empirical evidence in demonstrating the ROI. What if you have to demonstrate ROI? What do you suggest in this context?
Well, in our paper, we do review the Ottawa Hospital as one of our case examples, and they've made claims of savings of 2 hours per physician, and a lot of that, I don't know if they did a time motion study. Frankly, I think it's worth investigating further. But that is a significant efficiency gain. And what they were able to do is avoid a lot of time with the starting shift, at the starter shift when they were doing patient rounds, typically away from patients and away from all their activities in the hospital. And now they've kind of moved to the bedside, so care is rounds are being done at the bedside. I think they captured some time savings when they didn't have to queue up at the patient, or rather the personal workstation, and they were able to do things on the fly. So there is indeed some savings there. Other papers that we researched spoke to, just the speeding up of whether it be communication or processes like ordering of tests or doing discharges on the fly, as opposed to perhaps maybe saving a lot of the administrative component of your day until that window when you have time, whether it be at the end of your shift or between cases. Rather than batching it, things were done more on the fly, and that was recognized as a savings. And of course, for some organizations, and they may not always be in the developed countries, but certainly in the developing world, there's significant improvements in terms of care processes, and even something as basic as procurement ordering, fighting infectious disease, communicable diseases, and identifying that they exist and managing them much more quickly as a result of having mobile devices and connections that can be made between people who are going to manage that outbreak.
Yeah, I mean, if I go back to 10 or 11 years when Infoway started and Canada started on the EHR journey, there was a lack of empirical evidence around the EHR as well. So some of this is a bit of a strategic initiative and endeavor, and maybe from an ROI perspective, a bit of a leap of faith. So I think we're showing through our benefits. It's a bit of a leap of faith,
but there is, I mean, we access them, and I'm sure everyone else can, but all those large, multinational management consultancies have published papers in this space, and they all will give you some of their views. It might not always be evidence of where the benefit impact will occur with the use of mobile devices.
Great, thank you. Stanley, we spoke a bit about BYOD policies. Question here about resources in two other areas that are near and dear to your heart, privacy and security and interoperability. I know we mentioned both of those in the paper, but maybe for the benefit of the audience, where can they find those resources to take a deeper dive?
Again, the HIMSS mobile roadmap is an impressive source of information when it comes to privacy and security requirements, as well as potential policies that folks can use. The various information privacy commissioners in various provinces across the country have also issued white papers with regards to how to include privacy by design in mobile applications and mobile devices. So that's another interesting source of information. In our document, we do make references to the various sources of the new and emerging interoperability standards. And so those as well, again, it's very emerging at this point in time, but those are also available.
Thank you, Stan. And over to you, Mark. We saw a great example around Women's College and the use of mobile technologies in post-surgical discharge. That was in one department for basically one use case. And, if it's successful and it needs to scale, that presents a whole new set of challenges. What are some of those that we can highlight here that would aid our stakeholders in understanding how to scale these initiatives that are successful?
That's a great question. It's something that we ponder in the paper, and we try to include our point of view on that issue. I think innovation always starts at the edge of an enterprise, and it has to grow from there, and it needs support, it needs money, but it requires a set of an effort across the organization that we don't always see, and as a result, you get some of these stalled starts. It's not to say that mobile health computing isn't happening or it is happening in an informal way. We've discussed that already on the call. But what isn't always happening is there isn't a strategic alignment between the use of mobile devices and the overall information and communication technology strategy for the organization. It may not just be the priority that the end users are hoping it to be. And as a result, their pilot projects or their initiatives just don't get the kind of traction at the rate of pace that they hoped it would. We believe there needs to be that strategic alignment initially. Of course, there needs to be a business alignment. We need to focus on the vital few problems the best applications, the best use cases to apply this technology to go after those, those vital few as opposed to the useful many. And, cost is a real issue for many. Some of the interviews that we did, we had people saying to us, we're moving from a paradigm where we're using $5 a month pagers to now potentially supplying devices or asking people to supply their own device, but perhaps sharing or paying for a data plan. And those data plans, you can jump from $5 to $80+ a month or some prorated share of that. And when you're looking at some large enterprises with literally thousands of potential end users, this is no small adjustment to make from a cost perspective. There's a number of other reasons I would ask people to consult the paper and to give some thought to whether those types of issues are meaningful to their own organization.
Well, thank you very much, Mark and Stan. Just a few closing remarks. We will be sending a survey out to all the participants on this call today. So thank you very, very much for joining us. That'll go out in a few days. And that survey will also include some links to the presentations, which you'll be able to access, and the video. And if you want to share that, or if you happen to miss something and want to replay parts of it. So we encourage you to look for that. And in addition to that, you can download an executive summary of the paper or the full paper off of our website as well. So once again, thank you very much for joining us, and keep watching your event notifications for future webinars from Infoway. Have a great day.
Thank you again for joining us today. This does conclude our web conference, and you may now disconnect. Have a great day.